MCA COVID Public Service Announcement.
So COVID, as we now know, is is a virus that causes systemic effects. Since your blood vessels go all over your body, the effects of COVID are all over your body. And so the reason we have so many different types of symptoms is because of that. And so when you get sick, it may not just be your lungs, it may be other parts of your body, especially those that are considered to be more fragile. So if you have diabetes, for instance, the reason why diabetes is such a difficult problem is because the effects of diabetes goes all over your body because you have vessels all over your body. So what COVID does is it makes those problems worse. So and there are so many different effects from COVID. Viruses, they affect our immune systems, and we have manifestations throughout, even heart problems, the vessels surrounding your heart. We all know about the lung problems. We know about the blood clots in the brain. Inflammation everywhere. So the thing about COVID is that it is a very, very good example of what a virus can do. And the idea was, oh, it's a virus, it's only a virus. But actually, viruses are, HIV, Zika virus, Ebola virus, hepatitis, like Epstein-Barr virus. These are all viruses. And so viruses are not innocuous. It means that they're not concerning. They can be very concerning. There's a lot of questions regarding what would be the difference between getting the COVID vaccination versus getting COVID itself. The thing about the COVID vaccinations are that when you have the vaccination, your body creates an immune response against the virus. So initially you're going to have, some pain at the site where you had the injection. You might get some redness. You might even get a little bit of a fever. And then your symptoms will go down, and about a week later, you may get sick again. And that's what your body is that's when it's making its response. And so some people do not tolerate that extra set of inflammation. So if they're already kind of on the edge, very fragile, that's when our people who have COPD, for example, will develop a bronchitis or a bronchopneumonia, because what COVID did is it unearthed your fragility to being able to withstand a systemic inflammatory response. So when you get the the vaccination, you could get sick, but it's not the virus that made you sick. It was your body's reaction to making the immune response that's made you sick. And it means that you are actually probably not as strong or robust as you were when you were younger. When you get the actual COVID, this is the effects are not like 2 days and a week later. They go on and on and on, and we have this new awareness of something called long COVID, where people many months later are continually exhausted, and they have these symptoms like brain fog, they call, where they feel either depressed or they feel really tired. Their mind is not thinking as strong as they used to. They have memory problems. And these are all symptoms of the prolonged inflammation in our vessels that are all over our body. And so if you had a choice between, the short acting response to the vaccination versus this long COVID, which we don't have much data on, I think it's a lot safer to be able to take care of the effects of having the vaccination. It's safer. We're able to understand it better. We do have medications to take care of those side effects, but for the long COVID, we really don't know a lot of it. And that's information that's going to be coming out in the next months and years to come. What are the long-standing effects of having this virus? So I think it is safer to get the vaccination. When women are pregnant, they seem to react a lot more severely to having the virus. There was a time a few months ago where a huge proportion of the people in the ICU in Toronto were actually pregnant women. Um, Pregnant women are are strong, but they're also fragile, and they seem to be very susceptible to getting bad effects from having the virus. There has been a statement made by the Society of Obstetrics and Gynecologists of Canada, the SOGC, and they strongly support women who are pregnant to get the vaccination. Also, when the babies are born, the mother can provide passive immunity to the baby because of the antibodies that she's made because she had the vaccination. So these immunoglobulin A, which is a component of your immune system, it comes out in our tears, in our sweat, in our spit, in our breast milk. And so just by having the baby close to you, you are providing that baby protection because your immunoglobulins, your antibodies are going to the baby passively. That's called a passive immunity. There's a lot of things in medicine that we do nowadays, recognizing the importance of having skin to skin. When babies are born nowadays, even in the OR from a C-section, they put the baby right on the mom. And if they can't put the baby on the mom, they put the baby on dad. And what they're doing is trying to create skin to skin contact, which is not just for the baby's, awareness and waking up and becoming more, waking up to this new world, but also it takes about 30 minutes for the mother's all of the stuff that's on her skin to envelop the baby and protect the baby in a coat of this invisible immunity. And so that's called passive immunity. So women who are pregnant and breastfeeding are strongly suggested and recommended to have the vaccination. If anything, to protect themselves from getting really, really sick and ending up having to have ventilatory support in the ICU or other medications. And also for that new baby that comes along, that they can protect them passively, because right now we don't have vaccinations for our infants. And that science is not static, it changes over time. That's the nature of science. Having a scientific approach to something means that you ask a question, you have a hypothesis, and you come up with an answer, but that answer can change over time and with different types of variables. And so we expect in science that there is going to be change. However, the public, when they see these changes, get very upset because they don't understand, well, what last week they said something else and a month ago they said something else. Why are they saying this now? And that's because the public perception of science is that it doesn't change, but it actually does. That's why some people, will have something and not be, and will have symptoms and not get a diagnosis until later when it declares itself your problem in a certain way. And then we can say, aha, that's what it is. So, and then people are like, why didn't they pick it up before? And that's because the evolution of symptoms, the evolution of science, the information, it always changes. And that's why we are still going to have new and improved recommendations over time with this current problem. Right now, we have cases of the really worrisome Delta variant that started in India, and we're noticing that that's starting up again in Ontario, just as we're starting to open everything up. And that's why right now there's a race between this Delta variant, and the vaccinations. And there's a race to try and get herd immunity so that the Delta variant can be stopped and stop replicating in people and then changing again. So right now, it's really important that we continue to vaccinate our people, because the vaccines still work against the Delta variant. And so by having more and more people vaccinated, that means that less people are available for this virus to attach to them and start to grow inside them. So I think it's really important that the message go out there that we still have to be strong. We still have to stay with our social distancing, our masks, but we all still have to get the vaccination. And it's because we still have these humps, these new variants that are coming out, because every time it goes into somebody or a population, it has time to mutate, and we have to stop that. And the best way right now is using vaccines that work. And the ones that we have been using in Akwesasne work. The Moderna and Pfizer vaccinations still have effects against the Delta variant.